Welcome to Porchlight, a presentation of Porchlight VNA and Home Care, formerly Lee Regional VNA, providing top-rate and highly personalized care to individuals and families in Berkshire County and also beyond in the hill towns of Hampden and Hampshire counties, all in the comfort of their own homes. I'm your host, John Krol, and you know, living with heart disease is a reality for millions of people out there, and there are a lot of things to think about as it relates to keeping your health where it needs to be, especially with that special challenge. So I'm very happy to welcome to the program Anna Chapman, who is the Director of Clinical Operations with Porchlight VNA, and also Pat Bramer, who's the Director of Marketing for Sugar Hill in Dalton, because there's a wonderful program that's upcoming really just in a couple of weeks from now, focusing on this very issue, living with heart disease. So the two of you, welcome to the program.
Thank you.
It's great to have you. So Anna, you'll be giving this program, this presentation, and there are a lot of things to think about. We were actually talking before the show about several things, including reading labels properly and so forth. There's so much.
There's a lot that encompasses that people don't think about it when they have problems with their heart, and especially if they go into failure. The biggest thing is what you eat. What you put in your system is how it can affect your heart. So we teach people that they need to look at their labels when they're purchasing things. Especially try to stay away from canned foods, because canned foods, if you look at it and you read that label, you'll see how much sodium is in there. So we try to say get frozen vegetables. They're better for you, or fresh. But if you have to buy the can because you're on a fixed income, that's fine. Rinse them under cold water, because that takes away a lot of the sodium also. So part of what we're going out there is, what are you taking for food? What are you taking for drinks? Because that all affects your whole system. Part of the thing is learning about how your heart works also. So we give this nice little handbook to our patients, and it's something they can bring to their doctors, and they can keep a record of their blood pressures and all of that. But if they're also under the VNA services at that point, we have what's called telehealth, and that is a reading that our nurse who sits in the office gets every day. So it's a very simple system. The patient just goes and it tells them when it's time to do it. We set it up according to what time they want. They go and they put their hand in the cuff and it gives a blood pressure reading. Then they put their finger in the pulsometer and it gives them a pulse reading and an oxygen reading and also their weight. And we can keep an eye on that, and we can call the patient right away if there's a discrepancy and say, can you retest? Because maybe you took it at a different time today, or maybe you ate breakfast today, but yesterday you didn't. So let's check that out first. But then we also get to talk to them. It's a weekend, it's a Sunday yesterday. Did you go out somewhere? Did you go to a buffet? Because as we know, buffets are highly seasoned to taste good. And that could put on a 3 to 5 pound weight gain.
And the telehealth monitor does all that?
It gives us all that reading, but then we have a nurse back at the office who is monitoring that. So she's getting all that in, and she's watching those. And then she's personally picking up the phone and calling the patient and having a conversation with them. And if there's a concern, then we can call the physician immediately. We can send them those readings, and we can also adjust their medications. So say they need an extra dose of Lasix to help take some of that fluid off. Get an order, get out there, get it done right away. Try to prevent a hospitalization that way.
So the telehealth monitor does quite a bit.
It does quite
everything
a bit.
Except make coffee for you, probably, right?
That's right.
Makes you breakfast or something.
Right.
But that's a really wonderful device, and it makes the process more efficient in a lot of ways.
It does.
Because again, you're enabling you to monitor someone without being there on the premise saves a lot of time and energy. And then if there is something wrong, you can address it probably more quickly.
Correct. Yeah. And it also gives the patients a level of comfort. Well, I can speak from my mom. She goes in and out of heart failure, unfortunately, and she'll always want the telehealth in there because she can test herself during the day without us, she'll just test herself because she thinks her blood pressure's up because she feels that. So she'll go and put it on and she'll test it. Of course, we're going to get that reading, and then we're going to say, Mrs. H, you just tested yourself. Is something wrong? And she'll go, I felt like a little funny, so I tested my blood pressure. And we can look at it and we can go, well, it is a little elevated. What's been going on? I was out in the garden working. Oh, okay. things
That'll
like
do it.
that.
That'll do it.
Little things, but it makes them feel that just a phone call away, there's somebody waiting to answer their concerns for them.
Which that feeling of confidence is so important in
Correct.
keeping people in an independent atmosphere. Now,
Right.
Pat, with Sugar Hill, you have a wonderful community there where bringing in people like Porchlight to do presentations. So tell me a little bit about Sugar Hill, what it provides to the community.
We're an assisted living facility. We have 40 residents on what's called our traditional unit, and we have another 20 residents on our Safe Haven Extra Care unit. It's a place for people to come and live that aren't able to stay at home, that might need a little assistance with either toileting, bathing, showering, medication. They get the ability to take part in daily activities there, and just be able to associate with other residents there, so they're not home alone.
And I think, looking at communities like Sugar Hill, there's certainly a sense of community, which is very important because it's kind of that fine line. Anna, we talk about this, that everyone wants to be home.
Right.
That's always the number one goal, it seems to me. However, when you get to a certain point when you need a greater level of assistance, having an assisted living facility also gives that opportunity for those who perhaps were at home but not able to perhaps get out as much because of their physical ailments. This gives them more of a sense of community, Pat.
Yes. Some of the residents, it is assisted living, so we can only assist them with certain things. Once they become needing skilled care, that's when we can bring in Porchlight to still go in and do the skilled care there. But in terms of just regular assistance, we can provide all that care.
And I think that's an important point that Pat made because, again, we often talk about keeping people in their home.
Right.
This is the same scenario because as someone progresses, there is further opportunities on the continuum of care, and so there can be a choice for a family to say, well, do we want to remain with Sugar Hill while having home VNA services coming in, Porchlight to help out with that level of care, as opposed to going to a nursing home, which is a higher level of care. So that's a very important decision that families have to make.
It's a very important decision, and it's good that we can work hand in hand that way. All of a sudden you see a person starting to fail a little bit, what's going on, call the VNA, get in here, make an assessment by your therapist and your nurse, and make some changes and adjustments to what's needed. And then, contact the doctor, of course, always, because he's always part of that plan of care, and then keep the patient and the family both involved, because this is what we're going to be able to do to maintain the person in their current living situation. The diseases, or as we age, are harder for patients to keep them out of the hospital, but with having VNA services in there, I think we can bridge that.
And I think that's the key, and I think families would certainly prefer that because Sugar Hill has a great reputation, a wonderful place, and I know that I always see the van going around town. I happen to be a resident of Pittsfield, so I see that going from town to town quite a bit. Your residents are very active.
Yeah, we have an activities calendar that's, we take them to Tanglewood, we take them up to Williamstown's Theater Festival. We do events where we bring community folks in. We've got an event coming up for Folk Fest. We'll have some people come in and put on a concert for the residents. So all those things, help enrich their lives while they're there.
Folk Fest, that sounds fun.
Yeah.
And summertime in the Berkshires, and I would assume, Pat, for you, part of it, and I don't know where most of your residents were previous, but I would think that even there may be some former second homeowners or people who loved the Berkshires and would spend the summers there and chose to be in the Berkshires for assisted living.
Exactly. We do have some residents that grew up here. Their jobs took them away, and then they've moved back to here. We just had a couple, husband and wife, that were living in Houston, Texas, decided to come back here and move in to Sugar Hill. So they started here in Pittsfield, moved away, and then came back, and now we're living in Sugar Hill.
Right, and certainly, as our aging baby boomer population, continue, these are the things that families need to think about, and I think the complex part and what people perhaps need to understand as a family member is going through these transitions is exactly what we are just talking about, because there are many ways to skin a cat, so to speak, and that is, the choices that you make. How do you maintain someone in their home longer? How do they become maintained in assisted living longer? Often it really takes the family to ask more questions. I think that's an important thing.
I think as we're becoming that age, we're kind of the sandwich group here. We are more on the level of asking those type of questions. We research things more, we go online more, so we're getting more questions in the VNA prior to services even started. Well, what can you do? What will this cover? Will my insurance says they'll pay for X, Y, and Z. Sometimes we have to do a little research on the insurance because what they've been led to believe isn't always what they will cover. So, the upfront, honest answers helps to set the stage so that they're not like after, well, that's not what I thought I was going to get. You just can't walk in now and say, all right, this is what we're going to do, X, Y, and Z. You have to have a good plan in place. You have to have agreement by the patient and the family. And, and if they're in an assisted living, of course, we need to involve the assisted living with that, because you're not just on your own there. They're all part of the plan also, because they're going to be continuing to care for that person once we step out. So it's making, like you say, a good quality of life for that person, still remaining in home and safe.
And that is that coordination that you mentioned, important, because the families, for them, it doesn't matter if you have a Porchlight insignia on your jacket or a Sugar Hill or what have you. They just want the best care for their family member. And that's something that we always have to think about in healthcare. Make sure that because more than ever, these complexities are even becoming more challenging, even for us who work in healthcare, understanding the changes, because there have been a lot of changes, and there will probably continue to be changes as it relates to reimbursements and these types of things.
There's a lot of changes going on in Medicare, especially these days. Every time you blink an eye, a new change has happened. Patients are coming home sicker to all of us from the hospital. They're not staying as long because, Medicare is pushing on them also. So it's up to us in the community to be able to support that and keep them there, and then drive down some of those costs, hopefully.
And it seems to me that a lot of times the events leading up to that next place for someone to go, whether it be assisted living or even with home care or VNA services, usually it's an event that happens. We would hope that people will be prepared before that, but the reality is that usually isn't the case. Usually there's a fall or there's something. So Pat, tell me about that process. A family coming to you with someone who a family member who they think may need assisted living. How does that process work, and how do you gauge whether the person is appropriate for Sugar Hill?
Well, the first thing is we do a case assessment by our wellness director. She has a list of questions. She goes through medical history, what their needs are, and there's certain guidelines we have to follow in order to take someone at assisted living. They have to have a physician's clearance form, so their physician, their primary, has to okay them to come to an assisted living. And then we sit down and we make sure it's a good fit for the family and the resident, and make sure they're going to be comfortable there. We give them a tour. We usually have lunch with them. We encourage them to take part in activities that are going on there during the day. And then we try to find a roommate that they fit well with, and we introduce them to a roommate. And then we talk about finances too, because finances are an important part of the process. Once we get the finances, we figure out if they are going to be able to stay there, how long they'd be able to stay there, or what would be the next steps once they become a resident, they run out of funds, or we are unable to care for them, what the next steps might be, so the family knows that ahead of time.
That's interesting, and in healthcare, that financial aspect now more important than ever with some of the changes that have been made. Now, we did veer away from the congestive heart element a little bit. I did want to make
Perfect.
sure that we highlight that to a greater extent. So we did get to the point, Anna, where we were talking about the labels
Right.
and reading those
Right.
and making sure that that was the case. What are some of the other key things that are in your presentation?
Some of it is them learning how to regain their energy. So our therapists will go into some energy conservation techniques, because when you're in failure, you tend to use the wrong muscles. You use your accessory muscles, we call it, and you don't want to be using those muscles. So they teach them not to use those, how to do some pursed lip breathing, how to do some relaxation techniques. Sometimes it's just a matter of, can you put on some quiet music, kind of try to make your mind go somewhere else so that you can get that breathing under control. So that's some of it. Some of it is also the rehab with the physical therapists and occupational therapists. They're new on oxygen. They don't know if they can go in and take a shower with oxygen on. Yes, you can. You want to, because you're using a lot of energy when you're showering. Leave that oxygen on, because that's going to help you breathe better. They might trip over the cord because they're not used to having it there.
Right.
So safety hazards, what to do with your oxygen line so that you're not tripping over it. Don't be cooking over a gas stove with it. There's a lot of teaching that goes on that people don't even think about. Oh, I'm going home on oxygen. Okay. But, there's a lot of things you need to be careful about when you're on oxygen also. Don't want to scare anybody, but want them to be safe. The nurses will get into about their med management. Very important that they take their medication when they're supposed to. Some of them will play with it. They'll say, well, you know what? My legs aren't swollen today. I'm not going to take my Lasix. So they don't take it for a couple days. The next thing we know, they're retaining fluid. The next thing we know, they're in heart failure. So a lot of teaching, we do what's called teach back. And we'll say something to the patient, and then we'll say, now can you explain it in your own words what we just taught you, to make sure they have a good understanding of it. And if they're still not getting it, then instead of repeating, try it in a different way so that they can understand it and say to you back, oh yes, I understand, I need to check my labels so that I'm not taking a lot of sodium in. Part of our pathway when we admit somebody to services is that we see them nursing 3 days in a row, because what studies have shown is that that patient in heart failure will return to the hospital within a week to 10 days. So if we see them 3 days in a row, we're going to try to catch some of those things that might not be quite happening the way it should to keep them at home. And then get the physical therapist in, get the occupational therapist in, and we also put in a registered dietitian. And they're not covered by any insurance usually, but we feel it's for the safe and better care of our patient that they go in and do some teaching nutritionally with them.
A lot to think about, and it's interesting because it isn't what you would think, or it's kind of a challenge for someone who may be feeling they're having an episode,
Right.
basically to relax.
Right.
Isn't it?
Exactly.
I mean, it's counterintuitive.
It is
to
relax
suggest, and yet there are techniques that perhaps people can do to make themselves relax. Maybe some cues that
Right.
that are almost behavioral that
Yep.
enable their body to do that.
Yeah, there's that, and there's tapes you can play and other just ways of relaxing those
It's
muscles.
probably just a good thing to do anyway.
It is for
For a
all
lot
of
of
us.
us, whether we're having an episode or not, and so on. So this presentation will be in the dining room.
It's in our living room.
In the living room.
Yes.
So the living room is probably a big. It's not like my living room.
No.
Maybe a few square feet, but it's a very large.
It's a large room, yeah.
Area. So tell me about the facilities there at Sugar Hill. So you have that living room. Is that near the entryway, or is that?
It's near the grand staircase. So that's where we hold most of the events there. It's our largest room in the mansion.
And it's a mansion. So
Yes.
so tell me about the history of that
It was
building.
Senator Crane lived there with his wife and his staff. And then when he passed away, his son Bruce moved in with his wife. And then when his wife passed away back in 1991, then it was vacant until
Interesting.
an ownership group came in and purchased it and decided to make it an assisted living.
And so the building bones itself are probably pretty similar, and then there was a lot of renovations
Yeah, they put
inside?
the mansion is exactly how it was. There's some wallpaper painting that was done there, but they put a big addition on
I
to try
see.
to match the mansion from the outside. The brick and windows and all that, it tries to match the original mansion.
That's remarkable to be able to do something like that. And the mansion is, I'm not, how old is the? I don't want to put you on the spot.
not
but
sure.
It's,
I know,
it's old enough
I know
that they don't
President-
make them like that anymore.
President Taft came and planted a tree that's 103 years old.
Yeah. So again, interesting to be able, and I'm sure the town of Dalton was very interested in making sure that it was
Oh, yeah.
consistent with that as well, going back to those days. But really great concept to keep the consistency. Now, Sugar Hill is now changed ownership
Yeah.
over the last year
We're
or
part
so.
of, back in December, a company by the name of Vidal Healthcare out of Seattle, Washington, purchased 2 facilities. Sugar Hill, the assisted living, and Craneville Place, which is a skilled nursing facility up the street in Dalton. And then in May, they purchased Springside, which is out in Lebanon Ave.
Right, so those were, the transaction was from our friend Pat Sheehan.
Correct.
Who had been in this community for many, many years and had done some really great work. So he's kind of handed the torch off to this particular organization. So there is kind of a bit of a network there.
There is, and the good thing about it is the team that was under Sheehan Health Group is still with Vidal. So that team's still working together, which is nice.
Which had some pretty solid, I think even deficiency-free
All 3
survey.
facilities are deficiency-free.
Fantastic.
Yeah.
Not bad.
Not bad.
And we know, and in healthcare, the common viewer may hear that and probably not realize, but if you are in healthcare in the area of long-term care and you hear deficiency-free, it's a very well-respected
Yes.
rating to have received from the Department of Health. So that's very important. Congratulations
Thank you.
on that. As we have a few minutes left, I do want to make sure people know when and where. This is August 16th is the presentation.
Correct, August 16th at Sugar Hill, 2 to 3:30, right inside the mansion.
Right inside the mansion, and Anna will be, the show will be hers to drive. Yeah, exactly. The show will go on, and Anna will be doing it. And so how is it set up? Do you have a sort of PowerPoint presentation, or?
I don't. I have some handouts that we'll be doing, and I'm just ad-lib.
Ad-lib.
I'm ad-lib.
That's the best way
It's
to do it.
easier because then I can get more participation from the audience. Because if you've got the PowerPoint, they're just paying attention to the PowerPoint. And I want them to be able to talk freely and discuss things that they've had in the past. And, well, gee, I didn't know that. Or I go out to the buffet once a week, and my goodness, my legs always do swell. So, it's a lot of give and take, and it's easier learning that way when you're sharing with others who've been there. And they can say, yeah, I know, I was just in the hospital for that.
Yeah.
So a little bit of prevention here.
Fantastic, fantastic. And I assume that you're willing to do this type of presentation or others in other areas. So we
I
talked
am.
about that on a previous program, that in places like senior centers, assisted living, like Pat's building, and others.
Right.
I'm sure you're
They
open to
just need
that.
to contact the Porchlight VNA. We'll be glad to set up whatever anyone needs for us. Yeah.
All right, and as we have a couple minutes left, how can people get in touch with you, Pat, over at Sugar Hill? And it's Sugar Hill Assisted Living
Yes.
is the full term, although a lot of people just know it just as Sugar Hill.
That's right.
There on the main road right in Dalton. So how can people get in touch with you?
They can reach us at 684-0100.
100, and they'd want to talk to you, probably.
Yep, they can ask for me, Pat Bramer.
Pat Bramer. And Anna, how can people get in touch with? We have several ways.
We
that,
have
people
many ways, right?
touch with
But
Porchlight.
we can get in touch with Porchlight, and our phone number is 243-1212. Easy
And
enough.
also, there's porchlighthomecare.org
.org,
is online.
that's
and
right.
You're even on Facebook
Right.
as well.
And if you're interested in attending the program, I think either Pat or myself, I can get in touch with Pat and let him know if I get any calls. And then we'll be able to set that up.
Fantastic. Well, a pleasure again, Anna, having you on
Yeah,
the program.
nice being with you, Chad.
Always fun. And Pat Bramer.
Thank you. Appreciate it.
Great to bring you on the program for the first
Thanks for having
time,
me.
and we'll be talking to you. Thanks so much.
Thank you.
And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Have a great day.